Welcome to Cracking Cancer, where we tackle the tough questions about cancer with real patients and world experts. Our mission is to empower the cancer community through education, bring transparency to the oncology system, and drive funding for critical cancer research. Whether you're facing a diagnosis, supporting a loved one, or simply here to learn, we're here to bring clarity, hope, and action to the fight against cancer. Welcome, everybody, to Cracking Cancer, the podcast dedicated to answering your questions, all things cancer, while raising money for cancer research. I am your host, Kyle Concannon. I'm a medical oncologist at MD Anderson Cancer Center and physician scientist. And with me is Samantha Morel.
Hi, everyone. Samantha Morel. I have non-small cell lung cancer with a HER2 mutation. I am stage 4, and I am a patient advocate. So happy to be here.
Samantha, and today we're going to go over a topic that will help probably more everyone around the patient than the patient themselves, but definitely will be helping the patient themselves. Today we're talking about what not to say to a newly diagnosed or previously diagnosed patient with cancer, because there are a lot of landmines there. There's a lot of ways that these conversations can be really, really well intended and go completely the opposite of how you hope they'll go. Because this is not a conversation that many people are used to having. And without further ado, we'll jump into the expert here. Samantha, you've probably had many such conversations where you've been educated on what's probably not the best thing to have said to you.
Oh, boy.
Or your colleagues.
Yes, I have a list that we can definitely go through. But what I will preface in saying is everyone that I've ever interacted with when I've told them about my diagnosis and what I'm going through, all of these responses, even though it's like not what not to say, no one has ill intent. I think a lot of times people just don't know what to say when they find out that someone that they care about has a cancer diagnosis. And so oftentimes they'll say really inappropriate things that don't help. But they think that they're helping by saying what they're saying. I've had a lot of people say to me, I just don't know what the right thing to say is. So I'm just not going to really say that much, but know that I'm here for you. And I actually appreciate that a lot more than some of these statements that we're going to go into. And I think it's a good education piece too. If people ever say these phrases that we're going to go into to you, I think it's a good education starting point where you can like actually explain maybe why this isn't the best thing to say and the reasons why. But also, if you don't want to go into it, that's okay too. Sometimes I just nod my head and accept it and I move on. So there's all sorts of different ways of handling it. And I think we're definitely going to do a shorter podcast too about the things to say to someone that has cancer as well, because this will be very good for people to know what not to say, but it's like, okay, well, what should I say instead? So we can do that education piece as well. But let's go into it. So I'm going to go through some of the things that I've experienced, and it's totally up to you on how you handle these comments, depending on who it is. For me, if it's a random stranger, because for some reason I still tell random strangers in the supermarket or the checkout or whatever that I have stage 4 cancer, if they say something maybe that's out of line or not something I expected, I tend to not educate them as much because I'm like, this is just a member of the public. They mean the best. But if it's someone closer to me, I do tend to respond and give them a little bit of an education on that it's likely not the best thing to say, because I think it's important for them to know that a statement that they think might be really wonderful in their mind is actually not the best and doesn't make you feel all warm and fuzzy. And I will say some of these items are applicable to different stages of cancer, right? So some of them are applicable to anyone going through any phase of cancer, regardless of what cancer it is. Some of the ones I'm going to go through are applicable to lung cancer specifically, and then some are applicable to stage 4 only. Kyle has a great podcast about different stages of cancer where we go into it in a little bit more detail. But stage 4 is the cancer that I have. And so I'll be covering some of those comments that you shouldn't really say to a stage 4 cancer patient either. So, all right. That was a big disclaimer, but let's go into it. So the first one is everything happens for a reason.
I can understand the impulse to want to throw this one out there.
And ironically, before I was diagnosed with cancer, I would use this statement all the time. Even when bad things happen to me, I would say everything happens for a reason. So I understand why people say that, but saying that to someone going through cancer is probably in my top 5 things absolutely you should not say.
Yeah, from my perspective, I'm someone who comes from a religious background, and I think a lot of people with religious backgrounds, this is something that gives people solace
Yes.
and a feeling of comfort that things are going to be okay and everything's following a natural plan. So we want to, people want to send that out there to you to give you that solace.
Mm-hmm.
But when you hear that, what do you feel? What is the actual reaction?
My initial reaction is, well, then did I do something wrong? Am I being punished? Like, why am I being put through this turmoil? And um and then my reaction back now is, because initially that was my reaction, like, oh my goodness, did I actually do something wrong? But now my reaction is, this was just really bad luck. It didn't happen for a reason. I'm not being punished. I'm not being taught a lesson. Um, this is just really bad luck. And so that's kind of how I respond now.
Well, and how much of that do you think is the person saying that to you hoping to make you feel better, and how much is it them hoping to make them feel better?
I
Because this
think it's,
doesn't make sense to them either.
yeah, I think it's a combination, especially as I'm kind of known amongst my coworkers and friends and families as the fittest person that they know, the person that looks after themselves the most, eats the healthiest, and all the things, right? And so if Samantha can get cancer, what on earth is going to happen to the rest of us? And so I think they're grasping onto things to like make themselves feel better and also make me feel better, that like, even though you did everything right, you still got cancer, and like we need to justify that, and
Mhm.
justifying that is by saying everything happens for a reason.
Well, it's so interesting because in so many elements of our lives, when we're faced with challenges, a really productive strategy to overcome those challenges is to say, what is the lesson I'm supposed to learn? Like, how am I going to overcome this and grow? But when you're facing a terminal diagnosis that you didn't do anything to earn, it's not that those lessons don't necessarily apply in the same way that they do, if you a relationship ends, or some other really tragic thing happens that doesn't compromise your longevity.
Yep. But you have hit the nail on the head though, that we have been just naturally taught to review everything, learn from everything, and how we can do better. And it's
Yeah.
like, I can't do that with this
Yeah.
cancer diagnosis. So,
Like, I won't get cancer in the future. Like, what do
yeah.
you want me to do?
Yeah. So please don't say that to anyone who's going through, I would say, a cancer journey, but I would extend that to any illness, chronic disease, anything really. I mean, within reason, just don't say it. There's no need. There's really no need. um the next one is an interesting one. And I've actually posted about this on social media quite a lot. You have to keep a positive outlook, otherwise your cancer will grow. And I, while I do agree that I need to keep as positive as possible, I think it's okay for me to have moments of sadness and cry and scream and punch walls and whatever I want to do as a coping mechanism. That's not necessarily positive poly 24/7. And I would say this goes for anyone going through any cancer diagnosis at any stage. You're allowed to grieve the person uh, I kind of say my life before cancer and my life now with cancer. Like, you're allowed to grieve that older person that you were, and this is the new normal. And like, you're allowed to be sad. It's okay. But there is so much pressure, especially on social media, to be the most positive person that you have ever been, even before you had cancer. Because if you, my goodness, shed a tear, your cancer is going to take advantage of that. And I would love to get your input from that.
No, there's no biologic, I cannot think of a real biologic link between grieving over something as traumatic and devastating as a cancer diagnosis and making that worse.
Yep.
You need to be psychologically coping, like appropriately coping.
Yep.
This is something that people, no one has experienced having cancers until they get one.
Right. Right.
Knowing someone with cancer is very different than having one. That's why
Yes.
I need your help when we're doing these podcasts and tackling these questions, because I don't know what it's like in your seat.
Right. Right.
So I think, and it's so interesting because it not only do you have all these negative emotions around the consequences of a cancer diagnosis, but now you're supposed to feel bad about feeling bad about it.
Yes.
Now you have guilt about like not, skipping into your infusion appointment.
Yep. Yep.
Yeah. To me, that just puts lemon juice in the cut
Yeah.
to
Yeah.
say now you're making it worse because you like are appropriately grieving.
Yeah. And, I give myself X amount of time per day to do that grieving. And I allow myself to do it. And I would argue that bottling that up and putting on a brave face 24/7 is also not healthy. Like, you need to let it out. You need to scream into a pillow or whatever you do to cope. And I think a lot of people have this pressure that they also need to be super positive around their family members and, friends. And I often get told, like, you're so, especially at work, they're like, you're so positive. But then if I like shed a tear with my boss, like, he's very understanding and compassionate, but I think he's confused because I've been so positive. And it's like, now I'm, sharing some emotion. And again, he's super supportive, but I think it throws people off if you're so positive. And then all of a sudden you have a moment that, like, whoa, where did that come from? Because um, you're outwardly positive all the time. But it's like, it's okay to be sad with yourself. It's okay to be sad around other people. Um, and yeah, it's not going to grow your cancer. I mean, the amount of social media, like I said, that has said that is insane. And like you said, it makes me feel bad that I'm sad.
Yeah. Yeah. It seems like the best example of kicking someone when they're down.
Yes.
It just,
Yes.
that's a tough one.
Yep.
That's a really tough one.
Okay. Oh, this is up there. This is especially applicable for stage 4, arguably maybe other stages, depending on your cancer, depending on your journey. But the statement is, don't worry, you will beat this. And that one is often said with the utmost positivity, passion, and love. But for someone that is especially going through a stage 4 cancer experience, journey, whatever you want to call it, I'm not going to beat this. There's going to be a point, again, this relates to the positive outlook. Some people are probably cringing, being like, you can't say you're not going to beat this. There's going to be a point when my cancer takes over. That's just a fact. Whether it be in 5 months, in 5 years, whatever. It's just a fact of this experience, journey, whatever you want to call it. Some people get funny about what they call it too. So, yeah, that statement really bothers me and it really upsets me. And sometimes I am snarky, and even random members of the public who I'll speak to, because we start talking about stuff and I say I have stage 4 cancer or whatever, they're like, just be strong. You'll beat this. And then I go back and then I respond and say, I'm terminal. And it just floors them and they don't know what to say. And it is the most awkward thing ever. But it's like, I kind of just want to weirdly punish you because you've punished me internally by saying that. And I think, again, they mean all the goodness. I also think a lot of people don't necessarily know what stage 4 means. So they don't necessarily understand what that means. But yeah, it's a no for me. I hate it.
Yeah. And, it's interesting you mentioned that because that's something when a lot of people come to the oncologist visit, that is the sentiment they have is, I know the odds, I'm going to beat it. And that is a bit of a rallying cry to give you the energy to continue. And it's tough. We in the oncology community will probably never say that to someone. And what we'll do instead is we'll figure out what the goal should be in a real context. Because you can achieve that goal. And sometimes that goal is, it's having control and autonomy during, that last segment in having no symptoms, being able to hang out with family, the things you want to prioritize. In my mind, that's the goal you're going to beat. Like, we can do that. But I think a lot of people view success in the diagnosis of a cancer as beating the cancer to say eliminating the cancer.
Yes, very
And not
much so.
necessarily that achieving your goals in the context that you're in now.
Yep.
So I think that sentiment still permeates the community,
Oh,
the general community, the cancer community.
Yep.
So you hear that in the cancer community.
I hear it in the cancer community. I hear it on the street. I hear it everywhere. I've even had a few people in my hospital that I've just made connections. They're not necessarily doctors or nurses, but they'll still say like, "You will beat this," or "You've got this," And I've changed the tune now of being like, I want to surpass statistics of my odds, and so that's kind of, for me, how I will beat this is surpassing the odds of what I'm being told or what I've read on Google, which again, don't recommend doing that. But I have my own goals. Like you said, like, what are people's goals that they want to obtain, that means success for them, which is far more appropriate than I'm going to beat this or you will beat this. And honestly, I think even if I had a different stage of cancer and someone told me you will beat this, I wouldn't like it either, because it's just a weird saying.
Yeah. Yeah, I agree. Do you think that that's a reasonable response to someone who says that, to say, if they're like, you're going to beat this, don't worry, you're strong. And you're like, what, I have my goals and I'm on track to meet those goals. Like, how do you de-escalate that situation? Because people don't know what to say.
Yeah.
And that's almost a hard stop, that you will beat this thing.
Well, as I said before, like, sometimes I'm snarky if I'm in the wrong attitude mindset, and I'll just say I'm terminal, I'm not going to beat this. But I do know a lot of stage 4 cancer individuals don't like that word terminal, and I can totally relate to that and understand why. But sometimes I need to have that harsh statement to like make people realize like the reality that I'm facing. But if I'm in a nicer mood, I will say I'm just trying to make it to 40. And I turned 38 in September, so my goal is to make it to 40. And that kind of subdues people a little bit and brings them to reality, but like makes them understand, I think, a little bit more without me being like, I'm terminal.
Well, and there's a lot of strength in that response,
Yep.
because to say that is to bring objective reality into the situation,
Yes, very
you
much so.
know,
Yep.
and so I think there's a lot of strength in meeting them with the reality of your goals and
Yep.
what's potentially doable, and rather than you know shutting it down, which I think is not unreasonable. Like, you're allowed to be upset,
Yep.
um,
Yep. Yep.
and but that's the harder thing to do, I think.
Yeah. Yeah. And again, it's strongly related to the positive outlook stuff, right?
Yeah.
Because sometimes I'll say like, no, I won't beat this, or I'm terminal. I just want to make it. Even when I say sometimes I want to make it to 40, they're like, well, you can't have that attitude. You need to stay positive and say that you're gonna beat this. And it's like, okay, well, is my cancer suddenly gonna change its mindset because I'm thinking that way? And some people argue that yes, it would, but to me personally, I don't think that makes a difference. So I'm just gonna go with whatever I feel at the time.
Yeah.
So this one is also pretty strongly connected, but I think it's an important one to raise. You are a fighter, you will win this battle. And you are a fighter, you are strong, you are brave. My response, I rarely say this one back to people when they say it. I just kind of nod my head and acknowledge, but really what I'm thinking of is I'm strong and brave because I have to be. I don't have a choice. Like I didn't choose this reality. I'm going through the card that was given to me, and I'm being forced to be strong and brave. That's essentially my reaction in my head. And then you're a fighter. That's kind of implying that when someone passes away from cancer, that they didn't fight hard enough, and that really, really bugs me because while when someone is saying you are a fighter, it doesn't imply that. It kind of is related to that in some ways. And I get told all the time how strong and brave I am and how much of a fighter I am. And it's like, okay, well, when the time comes, does that mean I just stopped being strong and brave and I no longer wanted to fight? Like, so I don't think people are truly realizing what they're saying there.
Yeah. Yeah, and I think it ties into these other sentiments of wanting to be really supportive, but also not maybe fully appreciating what you're fighting for.
Right.
You're fighting for these goals that you have in this context that you're living in.
Yep.
And, I think it's absolutely true that to receive a cancer diagnosis and then to get the treatment that you need to meet those goals is a courageous thing. Because courage is not the absence of fear, it's doing what you need to do in the face of fear. That is courage. And so it is courageous. But I think this is something we hear a lot too. That's, I'm just going to keep fighting and fighting and fighting. And it's so hard sometimes to turn that around and say, I want you to keep fighting, but I want you to keep fighting for your goals, your realistic goals. And that might be, rather than if someone is doing poorly, fighting might look like spending more time at home with your kids or with your loved one or with your parents. That might be what fighting looks like.
Yep.
And I don't think that sentiment is permeating the communities as well as we'd like it to.
Yep.
When people say you're a fighter, does it seem to you like it means keep getting chemotherapy? Is that what they're saying? Like, what does that mean?
I think what they're implying is a mental mindset. of keep having, again, it goes back to the positive outlook,
Hmm.
is keep fighting like mentally and physically, I'm presuming, but it's like, over the past few months, I had my liver mets grow. Does that mean I wasn't fighting strong enough? Like, I don't think so. um, but I think they think it's more mental, like keeping that fighting attitude, like you've got this, and if you give up, that's when things are going to go awry. I think that's what they're trying to get at. And again, they mean well, but it's just not the best thing to say.
Yeah, and on the physician side, I've seen the detriment, I'll say, of that mentality when patients get really weak.
Hmm.
Sometimes the therapies that we give can make people more sick than they are helpful. So we can't give those therapies at that time.
Right.
And that can be really hard when someone wants to keep fighting, but fighting might actually hurt them if fighting means getting more therapy when they're not doing very well.
Yep.
So we balance these things all the time on the provider side, but no one has to reconcile those challenges like the patients do.
And this is a great segue, seeing as we're talking about chemotherapy. I get told often, especially on social media, don't do chemotherapy, it will kill you, not your cancer. And we could probably do an entire podcast on this topic. But my reaction, and I do actually respond to a lot of these people on social media because it really bothers me. My response is, chemotherapy is actually keeping me alive. So I'm actually very grateful for it. Now I know that, if you're not necessarily in the best state, right, in terms of comorbidities or like you have other issues going on, chemotherapy can do more damage than good, perhaps. Um, but in a lot of cases it's like extending people's lives and it's a good thing. But I'd love your thoughts on that.
I mean, it remains the single most effective thing we have.
Yep.
So I would say, one, when someone's like, don't do chemotherapy, it's like, who are you? Like, what do you know? You know, tons and tons and tons of people, like so many people are on chemo.
Right. Right.
And, it's coming from a good place because they don't want to see their loved one hurt
Yep.
and they don't want to see their loved one suffering for something that they feel isn't going to help them and it's maybe futile. But the reality is that there's a perception of chemo from years ago, and that perception is outdated.
Right.
So chemotherapy nowadays is not as sick, not as sick inducing, not as toxic as it used to be in most cases. Um, so I think people mean really, really well, and they want what's best for their loved one, but it's coming from a place where they're not well versed enough in the topic to be given this kind of advice.
Right. And for me personally, when someone says that, especially if it's a closer friend or family, it doesn't help at all. It's like, this is my treatment plan, this is what I'm doing. So for you to say like it's gonna kill you, that doesn't, I'm going to do it, so it doesn't feel great when you're telling me that. So another one I get often, and I know this totally depends again on what stage of cancer you're at and what cancer you have. But for me specifically, I get asked all the time, when do you finish treatment? And for me, having stage 4 lung cancer, I will always be on a treatment, whether that be my first, what's called first line, which is the first treatment that I go on, my second line, my third line, and however many lines there are available to me for my cancer, I will always be on treatment to some capacity. And so it's pretty disheartening when people say, "Oh, well, when is this treatment done? When can you have a break? And like, when can we go back to normal for a little bit?" And it's like, no, this is what I'm going to be on indefinitely until it stops working, and then we go to the next treatment. And that is a really tough pill for people to swallow. But I say it every single time just like that because I want them to realize, like, this is the new normal. This is what I'm doing, and I'm going to be on it till it stops working.
Yeah. And I can say from the provider standpoint, when I have these kinds of conversations with patients, if they're going to be on a therapy indefinitely, mostly this is talking about stage 4 patients or patients who have metastatic disease, when they ask, how long do I need to be on this? And I say, until the cancer progresses or you develop too many symptoms from the therapy,
Mm-hmm.
the face just drops. It is really hard to acknowledge or to hear and to be hit with that reality that this is just life now.
Yeah.
And, there always can be breaks, and those do happen, but it's not you're on chemotherapy for X number of weeks or months and then you're done. There
Right.
are situations where that's the case, but for a lot of people it's not. Um, so I would definitely not assume that. And it's tough because for the patient who does have a certain number of cycles and then they're done, and that is some cancer patients, there are
Mm-hmm.
many cancer patients who are in that situation. They actually really look forward to that end day,
Yep.
but it's the kind of situation that you got to enter into with a little more knowledge of what that person's going through, or you're just going to hit them over again with the same conversation I had with them,
Right.
where I you know overwhelm them with this reality of indefinite, like,
Yep.
and they have to relive that, which is really a terrible experience.
Yes.
That really hurts,
Yep.
and to make them relive that many times, because people ask this question a lot.
Yep.
How many, do people still ask you that, or?
Oh yeah, I got asked the other day.
Oh, really?
Yeah. Because I'm on a new treatment now. I'm on my second line. It's a completely different treatment to what my first line was. So the question came again, okay, well, how long are you on this one for? It's like, well, it's the same applicability applies. But I think like you said, there's a misconception, and I also think social media plays a part here, where you'll see a lot of times videos of people ringing the bell at different cancer centers, and actually at mine we don't have a bell, and I am so appreciative of that because I think as a stage 4 individual, hearing someone ring a bell, I'm gonna be more depressed than ever. Like, okay, well, why does that person get to ring a bell and I don't? So we don't have a bell. Um, but I know a lot of places do, and I wish that they would realize how detrimental that is to some of us.
Yeah, that is a sensitive topic.
Oh, it is? Okay. I
It
didn't
is.
realize.
And I'm going to say, so I think there's a group of optimists, and, then over here you have the realist pessimists.
Mm-hmm.
And I'm in that latter category. So I
Mm-hmm.
share your sentiment. I do not like the bell.
Yeah.
And there's two reasons. One is the one you just mentioned,
Yep.
is because the people in the waiting room who are getting their indefinite chemotherapy get to hear that someone else, had remission, or,
Right.
they're cured.
Yep.
And the second reason plays into the air quotes, which is just because you rang that bell doesn't mean you're cured.
Right.
Cancers that we believe are curable often come back.
Yep.
So that patient rings the bell, and then 6 months later, they have to go through all this again,
Yeah.
really believing they're cured.
Right.
So I don't like that. I'm with you. I'm a realist. Let's be considerate of everyone else around that doesn't get good news that day.
Right.
And let's be considerate of your future self, who, like, you still get scans, and that's because they come back.
Yep.
Yeah.
And
So,
yeah, and I
yeah.
don't want to be like I'm a realist like you and pessimist, but like, if I had a different stage and I was cleared for that period of time, like absolutely I'd want to celebrate. I would celebrate with friends and family in the privacy of my own home or someone's home. And yeah, I think there's even among the group of cancer folks that I know, like when they have good scans and they're celebrating, they also recognize that someone else might have had a really bad scan that day. And that like acknowledgement in the cancer community is like massive. Um, because if you're just kind of super excited and you're posting everywhere about your amazing scan, and someone sees that who had a really bad day and a really bad scan, it's going to make them feel even worse. So, like, just being cognizant of everyone's different experiences through cancer and like celebrating versus not, and just acknowledging like other individuals that might be having a harder time than you, I think is really important. And yeah, let's get rid of bells.
Yeah, I'm an advocate. The bell is it's bad on a lot of levels in my opinion. But to your point, you want to like those victories are substantial like victories to have someone whose scan
Yes.
is negative.
Yes.
That is something absolutely worth celebrating.
Yep.
But you think like get your friends, make your victories more private
Yes.
and your challenges more public. Is that kind of your perspective?
Yeah, and maybe someone would disagree with me there. Back in the original, I say back in the day when I was originally diagnosed and I was going through treatment, I was doing like a happy dance in front of my hospital, and my husband was recording it, and I posted it about my scans and like how happy I was with massive reduction, all this. And then looking back, now I've had a bad scan, was like, that could have been really in someone's face in a disrespectful way. And like, yeah, there's a fine line there. Like, absolutely, you need to hold on to those great moments. Absolutely, you do. Um, but maybe a little bit more privately to be respectful.
Yeah, and as someone who's on the delivering side of good news, I keep all the good news you get, keep it. Like that is well earned. Um, but there's always some risk that something wasn't quite seen, or the scan didn't catch this thing, and the next one in 2-3 months. So I always have this, I people deserve hope, and a lot of times hope is warranted, but you got to have that, can't be careless about emotions, like be a little reserved and protect yourself, for the possibility that things are not always going to be this way,
Yep.
and particularly for the other people, um, with social
100%.
media. Because you're
Yes.
right, I see it on social media a lot,
Yep.
and it's hard because you want to support, you want to rally with people and share in their positives, but you're not seeing the people who got the bad scan that day posting back by and large.
Right.
Um,
Well, apart from me, I did a crying video.
yeah, like no, actually, let me stop you there.
And I will say the reason why I did that is because, I did it in collaboration with the Young Lung community, and I did it because I literally filmed myself crying, and it was a very raw, real moment. But the reason why I did it is I wanted people to realize that this also happens, and it's not all celebratory on my page. Like, there are sad moments, and it's okay to cry and be sad and grieve. And so that's why I put it out there, because I wanted people to know that like you're not alone in these sad moments too. And so yeah, that's why I did it.
Do you think sharing that was harder than sharing the good moments? I imagine yes. And was it more empowering, or how did that feel?
It was actually really awkward, to be honest with you.
I could
Like
see that.
super, super, super awkward and very vulnerable too. And I didn't know how it would be taken. But I joke with people now about it that I got more likes and shares on that post than I have of any celebratory thing. And I don't know if that's because people like to wallow in sorrow and like they they look for those grieving moments. But also I think a lot of people out there have a lot of compassion and care. And so when they see someone who is super upset about a really big thing that happened to them in their cancer journey, they want to be there for them even though they've never met them. And so the amount of like kind words I got was through the roof. Um, but I will say, like, going back to all the things like you shouldn't say, I think a big part of it for me and my journey personally was I was having so many successes in the initial part of my cancer journey that a lot of my friends and family were naive to the negatives. And so all of the statements that they were saying were kind of in support of this amazing response, like, you really are going to beat this, or, you're fighting really hard and it's working. And so the reality of a bad scan, I think, kind of put everyone down to the reality of really what was going on, and maybe taught them some lessons too on like being cognizant of what to say versus not, because this is actually getting quite serious now.
Yeah. Yeah, I think people struggle.
Yep.
I struggle too, and it's the community I'm in. Um, but yeah, what else? What are some other things that have come up?
One I get all the time is, why haven't you lost your hair?
Are they mad at you?
I don't know.
It's other patients in the cancer community that are like, what, you know?
So I think this happens more because I've educated my friends and family on it. This happens more out in public, or I'm at an appointment, or I happen to talk about my lung cancer. They're like, "Oh, but you haven't lost your hair." And I don't know if that
Hmm.
implies like, "But do you really have cancer?" or
Interesting.
or it's I'm confused because I thought
Yeah.
everyone that had cancer would lose their hair. And some of my, in fact, the treatment I'm on right now, I might actually lose my hair. So then I won't get that anymore. But
No, they'll
um,
believe you. Yeah.
that happens a lot. And,
Hmm.
I'd love for you to, cover why some people lose their hair and some people don't. And like, that's just part of cancer.
Yeah. Yeah, I think a big part of that whole paradigm and like the idea that cancer equals chemo equals hair loss,
Hmm.
it probably comes in large part from the breast cancer community, which is a very vocal and very supportive community. And the breast cancer regimens can often cause hair loss. So not every cancer's regimen does cause hair loss, but the breast cancer one does. And since they're very front and center in patient advocacy, and I think they very proudly show when they have hair loss that this is a consequence, and they hit it head on, and it's very noticeable, very public, and I think a very strong kind of stance to take, that's led people to believe that chemotherapy as a group leads to hair loss, but it's actually a subset of chemotherapies that lead to hair loss. The lung cancer ones that you and I are most often around frequently don't. So I think that's probably where it comes from. Um, and 30 years ago plus, the chemotherapies that caused hair loss were more commonly used. So I think the perception that people had from their parents' generation, more of those patients had hair loss when they had a cancer treatment. So I think that's where it comes from. It's interesting because a lot of people now have wigs too.
Right, right.
So are they like, are you wearing a wig? Like, is that what they're at?
I have no idea. And in fact, I joke that, they clearly know I don't wear a wig because my hair's so messy. And then I joked with my husband that if I do lose my hair, I need to find a wig that has messy hair because that's who I am.
That'll be
I
believable.
can't have a pristine haircut because that's just not me. But yeah, it's almost like they're questioning it, like not in a negative way. They're just like, but
Yeah.
you have hair.
Well, and an interesting thing for those who, this is an aside, but for those who do lose their hair, a lot of times the hair will grow back differently than it was the first time. So you might have
Interesting.
straight hair, you lose your hair, and now you have like the wavy curls you always wanted. And
Interesting.
yeah, and I've worked with patients who, have had their hair loss from chemotherapy, and then it grows back and they're like, wow, this is great. Like, I love my hair now. Like, it's too bad I couldn't get this earlier. And I was like, I don't think people want to do chemo for a perm. But um but those patients had breast cancer that had that. But it's a really hard thing, and I think it's so visible.
Yep.
That's where it's so stark there.
All right. So the final one I have is I know someone who cured their cancer by taking X item. You should too. And I get this one a lot. And I know that everyone who sends me anything means they mean well. They 100% mean well. But the amount of stuff that I get shared with me that I should be taking puts so much pressure on me in terms of I should be doing literally every single thing that someone says that might have had an experience that cured their cancer, and therefore I should try everything. And if I don't, I'm failing myself. That's what I take from it.
Yeah, and there's a different thing every year. I
Right.
think that's what a lot of people don't realize is there's something in vogue. Like, every single year it seems that something new comes out, and those kinds of statements, I totally get where they're coming from. And people see a lot of stories that they tried this thing and their cancer shrank. And it's hard to see something like that and not want to help the people you care about. Like, I get that. The challenge is you never know what else is going on. These aren't in a format that we're studying it usually. And I think those kinds of statements breed a lot of mistrust between patients and us in the oncology community. Because, like, yeah, if something was a cure all, we would want it. And then the patient might want to try something, and you're like, well, there's no data for that. I can't support it. And they're like, well, why not? So those things actually can be really hurtful, not only to the person hearing it, the whole community that they're in, but I think, like, you hear so many of these. And so there's so many things that you should be taking, and many of them are not free. And, and some of them are in direct conflict with what you should be taking. I mean, what are some examples that have crossed you?
Oh boy. I have a long list of different things people have told me I should do. Um, Maybe that's a podcast for another day of all the things, but um, what I will say is, again, in addition to people sending them to me, I see them on social media all the time. I think my algorithm is messed up and not helpful to my well-being, but essentially it's just like you need to be doing this and then maybe you could cure yourself. And my response often is either yes, I'm doing that, thank you, or my response is I have, specifically for me anyway, I have a cancer that has a mutation within it, and it acts differently to just a normal cancer that doesn't necessarily have that mutation. And so while X person might have cured their cancer from doing X thing, is likely not applicable in my circumstance. So that's politely how I often explain it to people, and then they understand a little bit more. I would say if you don't have that excuse, then maybe it's a little bit harder to come up with a comeback. But there is a lot of pressure, I think, regardless of what cancer you have and what stage you're at, of doing everything that people expect you to try that is popular at the time. And it's honestly up to you as an individual to do your own research and see if it's something you're comfortable with, work with your care team to see if they're comfortable with it. Um, but don't take medical advice from strangers or friends who, again, really want to do good things, but it could potentially be detrimental to your care. So you need to be really careful.
Yeah. And, we appreciate that all these suggestions are coming from a good place. But, Samantha, correct me if I'm wrong, but you probably have a million things that you feel like you should be doing.
100%.
And someone saying, I read this and you should feel guilty is usually how this comes across.
Yep.
Like if you don't do this, then you're being neglectful.
Yes.
And that's not helpful. It turns out. Like
In
that's not
fact,
a
I was doing so much in terms of um different routines, and whether it be breath work, cold plunging, sauna, um what else? Qigong, which is a Chinese practice, acupuncture, and a multitude of other things, completely even unrelated to vitamins and different
yeah.
supplements, of just like, how do I cram all of these into my day in addition to working and in addition to just having cancer? Because I felt like in my head, if I didn't do one of those things, that might give my cancer the opportunity to grow again. And I had a little bit of a reality check with myself where I was like, you're more stressed trying to do all the things than you would be if you just didn't do them. Um, so that pressure is great. And I decided, okay, Samantha, every day, just pick one thing out of all the things you feel might benefit you and do that one thing. Do not try and cram in six things in addition to everything you're doing, because it's just too much and there's just too much pressure.
Yeah, that seems like a good compromise for the things that you feel like could help.
Right.
But again, there's so much out there, and
Yep.
people are grabbing on to what they understand.
Mm-hmm.
And it's since cancer is something that's so poorly understood, not only by people who don't study it, but even by people who do study it, it's really complicated. So it's really hard to try to justify and figure out what is the thing that could be helping you. And I get that impulse. I'd mentioned on other formats that I come from a low healthcare literacy family, and I had a brother with a genetic disorder. And the stuff that my family was trying to grab onto to try to help would have in no way helped. It would have certainly hurt, but it's what they knew, and you're so you care so much that you really, really want to find that thing. And a lot of times it's like, well, will it hurt? Like just do it. But there's a million of them out there. Like there's
Yes, there
so
is.
much stuff.
Yes.
And I think people don't realize how much the average patient with cancer is inundated with.
Yep. It's
You
so
know,
much. And like I said, it can cause more stress than good, because I don't want to be stressed, or not. I don't want to be as stressed as much as I need to be. And so, yeah, if friends and family can maybe not send articles and journals and advice every day, I think that would be nice to whoever you're um the individual going through cancer is experiencing, because it's just too much sometimes. And just know that that individual is likely doing their own research anyway, within reason, to figure out what this whole journey is going to be like for them and what maybe they want to do to help themselves. So there's no need to send all the things.
yeah. And to follow up on that, if you're a patient and you want to try something, let your medical team know. I think there's a lot of concern that you're going to come up with this idea and the medical team is going to say that's crazy. And, you know, it's better to have that small amount of conflict if there's conflict at all, which probably there won't be. But there is real risk that some of these things can change how your body metabolizes the chemotherapy medicines
Mm-hmm.
and the other anti-cancer medicines. So you really don't want to be on something that changes how your body metabolizes chemo or whatever else is going on, and the medical team not know about it, because
Yep.
that is something that people struggle with,
Mm-hmm.
is they want to try this alternative thing, and people are free to do that, but if you don't tell your medical team, you could really get hurt.
Yep. Yep. Yeah, I feel more and more confident to share with them all the out there, so to speak, stuff
Yeah.
I've tried, and they've definitely given me some funny looks, but have in the majority of cases been very supportive. So I appreciate that greatly from my care team, and I would say to any oncologist listening, when people have the confidence to bring these things up, that maybe they've learned themselves and they want to try, like, be respectful of acknowledging that, and don't shut it down immediately, and maybe provide some justification on the reasoning why you're saying no, to give them that level of confidence of, okay, I won't try it then, or yes,
Yeah.
I will.
Well, and the flip side of that too, I think there's a common conception that the medical community is against this stuff for profit reasons or something like that. And there's probably, for those who believe that, there's nothing I'm going to say that make you probably think otherwise. But my compensation has never changed based on the medicine someone is or isn't getting, and it's not why we went into this field. We don't, we suffer watching the people that come into our care suffer. We develop strong connections. We want to do everything we can, and we want to protect our patients too from things that seem predatory. There's a lot of stuff out there that I would say is truly predatory. Stuff that doesn't work, it costs a lot of money, and someone who feels desperate for control and to want to be able to do whatever they can will pay a lot of money for these things that don't work. So I think when you feel defensiveness from the medical team, it can seem like it's coming from a place where we have something to lose. And the reality is we do. It's the connection with the patient. We're advocating, and we feel we feel that pain too. Certainly not as much as the person who has to go through it. And usually I'll say, like, if you want to get your vitamin infusions, like, you're free to do, you can do that. I wouldn't, it wouldn't bother me. But for the person who's barely scraping by and they have to choose between that or chemo, or, it's like, man, there's a lot of people that applies to. And I think those kinds of things can be really predatory. And some of the alternative stuff, people will feel pressured into trying from family members instead of cancer medicines.
Yep.
And I've seen many cases where that happens. They don't work, and patients come in way sicker
Yep.
than they would have been. An early stage cancer might progress and it's no longer curable. So even if there is mistrust there, bring it up with your cancer team. And if you're feeling like, oh, this just isn't working, uh, then you can talk to a different cancer team too.
Yep, absolutely. And I believe we're going to do an entire podcast on this topic as well. So
Yeah.
that's going to be a fun one. So yeah, so those are kind of the top ones that I had on what not to say. I believe we're going to do a podcast too on things to say, that provide more support, than these statements we've talked about. And again, people that say these, I know they mean well, but I think explaining them in a little bit more detail, like we have, helps people realize why it maybe isn't the best thing to say at the time. So hopefully some lessons learned there.
Yeah, hopefully you all got something out of this episode. And since this will be up on YouTube and other formats, put in the comments below the things that might be helpful for people to know not to say, things that maybe you've received and it did not feel the way it was intended. We acknowledge people are trying their best. But the way these things improve is by people hearing more and understanding your perspective.
Absolutely.
So feel free to add those comments there. But otherwise, I think we'll leave it at that. Thanks everyone for listening. And for more content, like, subscribe, and visit crackingcancer.org. And then we'll see you next time.
Thanks, everyone.
Bye. Thank you for joining us on this episode of Cracking Cancer. If you found this helpful, please like, subscribe, leave us a review, and visit crackingcancer.org for more information. Every dollar we earn goes directly to furthering the podcast and supporting vital cancer research. Because together, we can crack cancer.